A silent threat, 8 signs that could indicate type 2 diabetes. Type 2 diabetes, medically known as diabetes mellitus type 2, is a chronic condition that involves insulin resistance or a lack of insulin production. It profoundly impacts how the body processes blood sugar, which is vital for cellular energy. Often insidious in onset, it can lead to severe health complications if unmanaged, making early detection imperative. Globally, the rise of type 2 diabetes is alarming. The World Health Organization reports over 422 million people living with diabetes, with type 2 accounting for about 90% of these cases. It's increasingly diagnosed not only in adults but also in children and adolescents, largely attributed to escalating obesity rates and sedentary lifestyles. The implications of this trend are far-reaching, affecting healthcare systems and families worldwide. A primary risk factor for type 2 diabetes is obesity, particularly abdominal obesity. Excess weight hampers insulin effectiveness, increasing diabetes risk. Other factors include genetics, lifestyle choices, and ethnicity, with some groups being more predisposed than others. Recognizing these risk factors is crucial for prevention and early intervention. Type 2 diabetes often begins with subtle symptoms, making it easy to overlook. Many live with it for years, unaware of the damage being done. Symptoms like increased thirst, frequent urination, hunger, fatigue, blurred vision, and slow healing wounds often go unnoticed or are attributed to other causes. This silent progression can culminate in devastating complications, including heart disease, stroke, kidney failure, and impaired vision. Therefore, understanding and recognizing these symptoms is vital. Education and awareness are key in combating type 2 diabetes. By understanding its causes and risk factors, individuals can take proactive steps in lifestyle modification, potentially preventing or delaying its onset. Regular screening, especially for those at higher risk, is essential for early detection and management. To address this crucial health issue, I will outline the top 8 signs of type 2 diabetes in today's video, empowering you to recognize and take action against this silent threat. The first sign of type 2 diabetes is increased thirst, medically known as polydipsia. When the body struggles to regulate high blood sugar, it tries to eliminate excess glucose through increased urination, leading to dehydration and a heightened sense of thirst. It's important to note if you're feeling unusually thirsty or if you're drinking significantly more water than usual, as this could be an early warning sign of diabetes. Secondly, frequent urination, or polyuria, often accompanies increased thirst. The body attempts to rid itself of surplus glucose through urine, resulting in more frequent trips to the bathroom, especially at night. This symptom can disrupt your sleep patterns and daily activities, and if you notice a significant change in your urination habits, it could be indicative of type 2 diabetes. The third sign is unexpected weight loss. When insulin resistance prevents cells from using glucose effectively, the body starts burning fat and muscle for energy, leading to weight loss. This symptom can be misleading because it might initially seem positive. However, if you're losing weight without changes in diet or exercise, it's important to consider diabetes as a possible cause. Fourthly, increased hunger, also known as polyphagia, is a common symptom. Despite eating regular meals, you might find yourself feeling consistently hungry. This is because the body's cells are not receiving enough glucose, leading them to signal for more food, hence the persistent hunger. Fifth, fatigue or chronic tiredness is a notable sign. Inefficient glucose conversion into energy leaves you feeling unusually tired or lethargic. This fatigue can be subtle, but if you're consistently drained without a clear reason, it's worth considering type 2 diabetes as a potential underlying issue. The sixth sign is blurred vision, which occurs when high blood sugar levels cause the lenses in your eyes to swell, impacting your focus. This symptom can fluctuate with blood sugar levels, but should not be ignored as it can lead to long-term vision problems. Seventh on the list is slow-healing sores or frequent infections. Elevated blood sugar levels can impede the body's healing process and weaken the immune system. This is particularly evident in the lower extremities like feet and legs, where cuts, sores, or infections might take unusually long to heal. Finally, the eighth sign is the development of darkened skin patches, known as acanthosis nigricans. These patches typically appear in body folds and creases like the armpits, neck, or groin and are linked to insulin resistance, a key feature of type 2 diabetes. Changes in your skin's appearance, particularly these dark patches, should prompt consideration of diabetes screening. Recognizing these signs early and seeking medical advice is crucial. If you notice a combination of these symptoms, it's advisable to consult with a healthcare professional. They can recommend the appropriate diagnostic tests, like blood glucose monitoring, and guide you toward effective management strategies for type 2 diabetes. If you find yourself exhibiting these symptoms, it's essential to contact a healthcare professional and request a hemoglobin A1C test. The hemoglobin A1C test is a blood test that provides an average level of blood sugar over the past 2 to 3 months. It's a crucial tool in diagnosing type 2 diabetes, as it shows how well you're managing your blood sugar over time. This test can reveal not just the presence of diabetes but also how advanced it might be. Type 2 diabetes doesn't always require lifelong medication or insulin therapy. In many cases, it's possible to manage or even reverse the condition through lifestyle changes and diet. Last but not least, to effectively address type 2 diabetes, let's delve into 6 lifestyle modifications that can significantly reduce the risk, promote natural recovery, and support the healing process. The first lifestyle modification to consider is incorporating a balanced, low-sugar diet. Reducing intake of processed sugars and refined carbohydrates is crucial. Focus on eating whole foods like vegetables, fruits, lean proteins, and whole grains. These foods help stabilize blood sugar levels and reduce the strain on your insulin-producing cells. Additionally, fiber-rich foods are beneficial as they slow down glucose absorption, preventing sudden spikes in blood sugar. Secondly, regular physical activity is vital. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking, swimming, or cycling. Exercise helps improve insulin sensitivity, allowing your cells to use the available sugar in your bloodstream more effectively. It also aids in weight management, which is a significant factor in controlling type 2 diabetes. The third modification involves maintaining a healthy weight. Even a modest weight loss of 5 to 10% can significantly improve blood sugar control. This can be achieved through a combination of diet and exercise. Focus on creating a calorie deficit either by eating fewer calories or increasing physical activity, but always consult a healthcare professional before starting any weight loss regimen. Fourth, managing stress effectively is key. Chronic stress can affect blood sugar levels, making it harder to control diabetes. Techniques such as mindfulness, yoga, and deep breathing can help lower stress. Additionally, getting adequate sleep each night is essential, as poor sleep can negatively impact blood sugar levels and insulin sensitivity. Fifth, consider incorporating foods high in chromium and magnesium into your diet. These minerals are known to enhance insulin action and glucose control. Foods rich in chromium include broccoli, oats, and green beans, while magnesium-rich foods include spinach, almonds, and black beans. A balanced diet including these nutrients can support blood sugar regulation. Lastly, staying hydrated by drinking plenty of water is important. Water helps to remove excess sugar from the blood through urine and helps to avoid dehydration. It's also a healthier choice compared to sugary drinks, which can cause spikes in blood sugar levels. Aim for at least 8 to 10 glasses of water a day, or more if you're active or live in a hot climate. Adopting these lifestyle modifications can significantly impact the management and progression of type 2 diabetes. These changes not only help in controlling blood sugar levels but also contribute to overall health and well-being.